Welcome to Laser Skincare Center. My name is Dr. Joanna Chan. I grew up in Texas and attended Harvard College, Stanford Medical School, and residency at UT Southwestern in Dallas. Following residency, I went to California Skin Institute where I completed a Mohs micrographic fellowship, which is for skin cancer surgery and facial reconstruction, in addition to cosmetic surgery. In 2012, I joined Laser Skincare Center as a full partner, and I've had this as my home ever since. So Mohs micrographic surgery is the best treatment for skin cancer when you want to minimize injury to normal skin. So what happens is the cancer is removed with a very small margin, but processed in an entirely different way. Normal excision is removed with a margin of 4 to 5 millimeters and processed with bread loafing, so the specimen is randomly cut. And that means about 1% of the tissue edge is examined. By contrast, in Mohs micrographic surgery, the specimen is removed with minimal margin, but processed like a pie, where we examine the entire crust of the pie. And that lets you examine 100% of the tissue edge while you wait. The tissue is frozen and processed quickly and mapped out. So we actually track the tumor with a microscope so that each individual cell is removed. This allows you to have 100%, almost 100% cure rate, 99.9%, compared to 94 to 95% with standard excision. If there is cancer left after the first stage, we are able to map it out and take out the cancer only where it's left. For instance, if it's at 12 o'clock at the top, only a small amount at the top is removed. If that is clear, then we're able to do reconstruction right away in the office without having to go under general anesthesia. When you come in for consultation for Mohs micrographic surgery, we go over the pathology report, we answer your questions, we mark out the tumor together, we discuss expectations as well as potential repair options. We often will recommend that you stop blood thinners such as aspirin, fish oil, vitamin E, ibuprofen, and possibly prescribe you an antibiotic to prevent infection. We're lucky at Laser Skincare Center to have a pathology lab right here on premises, which means that we can get your specimens right away. It does take a few days for us to process permanent sections, but we can expedite that so that you can have your results in a matter of days. Mohs micrographic surgery describes the technique of processing the tissue. However, many people do Mohs surgery. In our office, however, only Mohs college-trained physicians do Mohs surgery, which means that we did fellowship beyond residency and did thousands of cases prior to even trying it in practice. This is in contrast to most society physicians who often take a weekend course and are then certified.